Hello, and welcome to the Integrative Medicine panel on women in research. It's an absolute pleasure to be joined by several of my collaborators and colleagues.
Thank you, Kathryn.
Sorry about that.
So a little bit about my career path. I attended medical school at the University of Washington in Seattle, where I did a MD PhD program. And I actually grew up in a family that used a variety of integrative approaches to health. And that's really sort of what sparked my interest in this field. And so for me, initially, the decision was, do I go to medical school or do I go to naturopathic school? And I really wanted to do research in the field of integrative medicine. And so that's why I chose medical school and was in a medical scientist training program, combined MD PhD program. While I was doing the PhD portion of my training, I initially tried to find a way to do some research in integrative medicine, and that didn't work out. But while I was in my PhD portion, I had the opportunity to attend a medical student elective that really sort of sparked my interest more in integrative medicine and became sort of a doorway for beginning to integrate some of these things into my training. And also at that time, the University of Washington started hosting an interprofessional mind-body medicine course for the medicine, nursing, and pharmacy students. And that really opened up my mind to the value of these practices for us as clinicians, as well as for our patients. And when I got back into my clinical rotations as a third and fourth year student, I really saw the burden of chronic disease and what wanted to be doing my professional work in a way to sort of address some of those lifestyle issues before they became chronic health conditions. And so I was fortunate to come to Boston, where I did my internship in internal medicine, residency in internal medicine at Beth Israel Deaconess Medical Center, and had the opportunity to work with Gloria Ye and Ted Kapchik and others there as a resident doing some research, and then stayed for the fellowship in integrative medicine that we both were part of together. And my experiences in residency there really sort of opened the door for me to practice mind-body medicine clinically. I had my second clinic site at the Benson Henry Institute, and went there and worked there for 5 years before transitioning here to the University of California a year ago.
Thank you, Michelle. Now I'd like to invite Dr. Rao to tell us about her career path and how she got to where she is now.
Practice mind-body medicine clinically.
Good afternoon, everyone. Thank you so much for inviting me to participate in this panel. Just a little bit about my background. I went to a joint MD PhD program similar to Dr. Dossett, but at Johns Hopkins University, where I studied.
To tell us about her career path and how she got to where she is now.
Practice mind-body medicine clinically.
Good afternoon. Should I keep going? Thank you so much for inviting me to participate in this panel. Just a little bit about my background. I went to a joint MD program similar to Dr. Dossett, but at Johns Hopkins University. Maybe I'll keep going. I studied. I did my PhD in neuroscience, and just from the very beginning was really interested in understanding how sort of the biology and the mental health and psychosocial components of health interact. Sort of clinically was drawn to pediatrics and ultimately pediatric GI, and I did my clinical training in those at Boston Children's Hospital. I think one of the things about pediatrics is that it's inherently integrative medicine. We don't sort of talk about that as a separate layer, but really taking care of children involves really thinking about nutrition, diet, the whole psychosocial context of health, and the family as really a unit. So for me, I think that integrative piece is really inherent to the practice of the patients I see. Now in addition to seeing pediatric GI patients, I also do basic and translational research. I run a research lab studying the enteric nervous system, so really the nerve circuits of the gut, and how those circuits are important for gut health, and how dysfunction in those circuits might play a role in digestive disease. So for me, I think that's
Thanks, Mina. Mina, would you also just check to make sure you don't have another window open? I think we've got a report that there's some feedback, and I think that once you muted, we lost it, so it might be on your screen. Maybe from the previous link. So while Mina's looking into that, we'll continue. Thanks so much for bearing with us. We'll get it right. So I'm really excited to now introduce to you Dr. Julie Buring, who is the principal investigator of one of the largest women's studies in history, the Women's Health Study, and is also one of my mentors, Dr. Biering.
Thank you. So I'm a chronic disease epidemiologist, and I'm in the Division of Preventive Medicine at Brigham and Women's Hospital and Harvard Medical School. And my sort of focus is primary prevention, especially in heart disease and cancer. What can we do to reduce our risk of developing these diseases for the very first time? I'm particularly interested in women. And in terms of the methodology, sort of my day job is the design and conduct of randomized clinical trials. So unlike Michelle and Mina, I didn't come in through clinical work. I'm not a physician, so I came in through methodology. And I had an undergraduate degree in math, a master's degree in biostatistics, then I got a doctorate in epidemiology at the Harvard T.H. Chan School of Public Health. And cancer and cardiovascular disease were my main interests, but integrative medicine has always interested me personally. But then it started interesting me professionally, because when I would go and look at the literature, try to see what recommendations people were making, I really didn't feel that the articles that were published were quite as rigorous as the ones that I would be reading for other areas. So what I really wanted to do is see if I could work on the methodology of doing the study so that people would have the information that they needed to be able to make their own personal and then more public health recommendations and decisions. So, but I didn't know how to do this. I didn't know how to get involved. I'm not an integrative medicine expert in any way. But I did have a skill set that I thought maybe I could apply to it, which is just the design and conduct of epidemiologic studies. And moreover, I did have some cohort studies in our area that we could put questions on or try to use as a way to get more information among larger groups of people. And in fact, it turned out I'm not even sure I exactly knew what integrative medicine was, because it turned out that my trials had been looking at dietary supplements like multiple vitamins and vitamin E and vitamin D and fish oil. And in fact, that's part of integrative medicine. So in fact, when I learned a little bit more, I could see that it honestly touched many people who might not even think that they're interested or are working in integrative medicine. So I began working with the Osher Center here in Boston, back with its first director, Dr. David Eisenberg. And I've been very excited that in addition to the cancer and cardiovascular disease, which I still focus on in terms of primary prevention, I have an opportunity to use my skills in another very important area, which is integrative medicine.
Fantastic. Thank you so much. One of our next questions is going to be about what challenges we've faced as women in research and as researchers. Before we go into that, I'll just give you a little bit of my background. I went to graduate school at Harvard Medical School, and then I did my postdoc at the Dana-Farber, and then I decided to go to industry. So I'm somebody who's been on kind of, I like to think of it in the Joni Mitchell song, on both sides now. I've been in pharma, and then I decided to come back to academic medicine, where I could really kind of follow my passion for research. And I was really happy to come back, and I joined the fellowship in integrative medicine. And I think there's a panel discussion on that today. It was an amazing experience. Michelle Dossett was 1 year ahead of me, and we shared an office for many years. And then I started my faculty position at Brigham and Women's Hospital, and I'm now in Julie's division as an assistant professor. I think we're going to talk about the challenges that we face in our careers. And I think I hadn't thought about this one, but I went earlier this week to a leadership conference for women in research and medicine. And one of the issues that came up was childcare. And my daughter is now 30 years old, so I kind of forgot about those tough early years. But those tough early years started, with being pregnant in a lab where there was, radioactive work to do, there was tissue culture work to do, and nobody really wanted to hear about it. You're expected to work and just keep going. And like I said, this was 30 years ago. And I remember literally being in the lab, and around 9:30 p.m. in the lab, my water broke, and I walked across the street to Brigham and Women's Hospital, and 10 hours later gave birth. And then I was back to work in 2 weeks, which was crazy. And hopefully, things are not as draconian as they were for me back then. I think that, to my point earlier, which you may or not have heard because of our problem with background, I think that back then, we were really supposed to espouse and to, strive for a more patriarchal template where, there were no children. Children were, taken care of off the scene. And so I'm really glad that there have been so many efforts to engage and embrace diversity, not just obviously with, diversity in race, ethnicity, religion, but also in sex and gender. And so here we are today, a testament to the human ability to change and grow. So that was one of my challenges, certainly. And Michelle, I'm going to invite you to share a challenge that you have experienced as a researcher.
Thank you, Kathryn. I think, and thinking about one of the biggest challenges I've faced is finding myself in a professional environment where I expected supervisors to really sort of support my career progress, and find that they were undermining it, and issues of gender bias. I had thought that was a thing of the past, and certainly the last few years have shown us that, unfortunately, it's still rather prevalent in academic medicine. But I think, working through that experience taught me a lot about advocating for myself, a lot about being okay with being vulnerable, and with learning to ask for help, and receiving help from a variety of sources, and eventually finding a way to sort of work through that, that ultimately I think served my highest good as well as the others involved, and has given me new perspective on the challenges we face with burnout in academic medicine, and the role that implicit bias, gender bias plays in faculty burnout, and how leadership can play such an important role, either in creating a culture that is welcoming and supportive, and facilitates the development of faculty, or doesn't. So it's given me a lot to think about.
Thank you. Mina.
I think, in thinking about challenges, it's probably for me, the greatest challenge is one you already touched upon, which is really balancing parenting and work. And that's been made particularly acute over the past few months. And I can't say I've necessarily overcome the challenge, but I think every day learn to manage it. And I think, as a challenge and as something that's definitely has affected me a lot in terms of my ability to manage other people as I kind of grow my group. I think I've gained a lot of understanding and learn from ways that people have, leaders or managers of myself have treated me over the years as I sort of balance this challenge and things that have worked and things that haven't. So I think it's been a challenge, but as well as a blessing, because it's definitely, I think, helped me become a better manager and leader myself. But it's definitely not one I can say I've successfully overcome by any means.
Julie.
I've been asked many times whether it was a challenge for me over time being a woman. And to be honest, the harder one for me was being a non-MD in an MD setting in a hospital. That was the one that was harder for me to know how best to overcome. And at the same time of that was when we were sort of learning that doing epidemiologic studies, for example, is a team sport. I had always thought I would just go to my office and just do my study, and I'd work on it hard, and then I'd publish it, and I wouldn't have to deal with anybody. It doesn't work like that, because especially now when everything we're doing is interdisciplinary, no one is going to know everything to be able to do a study. So for me, it was always trying to work out in any setting, how do I be clear about why I'm at the table? Mm-hmm. What is it that I can uniquely add to this situation that someone else wouldn't be able to? They're able to add something else, but not what I've got. And together, we're stronger than if one of us tried to do it alone. So I think that's been a very hard lesson to learn, that you really do have to bring people together that together have all the complementary skills that you need, but you have to be very sure and very confident about what you can bring. And that was not my strong point, but something that I learned to try to work on over time.
Thank you. So I'm going to add a question. Don't worry, you guys. It will be very straightforward, because it occurs to me as I sit here listening to you, each have a really interesting background and link to kind of what's happening in our society today in your research. Michelle Dossett does research on the patient-doctor relationship, and certainly that is something that has undergone an unprecedented change, moving from the doctor's office to virtual visits. I haven't myself gone a virtual visit yet, but I know you, as Michelle and Mina, as physicians, have probably done many.
I was a patient. Yeah.
And you've been a patient. And so, Michelle, I'm curious to know kind of what your research is telling you, or what kind of, how that's going to shape your research. And we'll start there.
Oh, you're muted.
Oh.
Thanks, Julie. It's been interesting because, my research was shut down initially because of COVID. One of the things I do in my studies is I bring patients and clinicians together in the same room, and we're doing video recordings and physiologic measurements of the dyad as they're speaking to one another. And so we just recently started up our studies again, And one of the things that we're doing to keep physical distancing is we're having the doctor and the patient meet each other on a video telehealth platform in separate rooms, and still with the same, still with all the same, get up with the physiologic measurements. They're both in our research space, but in separate rooms, and we're starting to ask, do these same sort of phenomena that we see in the office play out in video telehealth visits. And of course, one of the things that I realized immediately as we're setting up backup video cameras is, what you see of me here is only a fraction of what, in terms of full body language, I'm doing. So if I'm talking with my hands, unless they're up here, you're not going to see them, right?
Wow. Yeah.
But if I have a backup camera going that has a fuller view, and do people rate that differently than just seeing my head? I don't know. But there's obviously a whole host of questions that we can ask. I will say, as a clinician, patients have been incredibly grateful for the opportunity to meet with us via video, and to be able to maintain that connection. Mina?
Yeah. Mina, and so your question is similar, but slightly different, because you and I have collaborated on a really fascinating study where we've observed that there are fundamental differences in gut motility with sex hormones. So there's no kind of more striking difference is in gender or sex than sex hormones and gastroenterology. And as you think about your work, like how do differences between men and women kind of inform your research?
I think, over the past 5 years in the lab, the more we've looked for sex differences, the more we've found them, and often in very sort of fundamental, basic things, like the reflex circuit that gives you peristalsis, or how things move along in the intestine, might be sort of wired or regulated fundamentally differently in males and females. And so when you see data like that, to me, it really makes me step back and say, we have to question our assumptions about so many things when we see patients, when we think about a diagnosis or disease. If you take something like irritable bowel syndrome, which affects close to 10% of the population, that maybe male irritable bowel syndrome is fundamentally a different disorder than female irritable bowel syndrome, and we shouldn't even be talking about them as the same thing. And I'm not suggesting necessarily today that they are, but it's just, I think it's important it pushes us to sort of step outside of the boxes, and that sort of not just say, do men and women have different manifestations of a disorder, or should we use different treatments, but really say, are these even the same disorder, or do we really need to think about this as fundamentally different pathophysiology for sort of the most basic diagnoses that we have?
Thank you. And Julie, you are one of the PIs of one of the largest women's studies ever in the world, 40,000 women. So, and you've kept in touch with them for the last, is it 30 years now? How have, what have you learned about this cohort and how they've fared throughout this pandemic? Is there anything novel that you're seeing that would be specific to women? And because it's been 30 years ago and they were already, above the age of 45, it's aging women as well. Mm-hmm. What have you learned from them?
Well, one thing that's very interesting is, so the cohort, again, is mostly chronic, looking at chronic diseases, loss of cognitive function, eye diseases. But we had the opportunity to add a COVID questionnaire in there. And what we learned very quickly is there was almost virtually 100% response to that questionnaire, that they really wanted an opportunity to talk. To actually tell us what was going on. And the questions were the ones that you would expect: first diagnosis, symptoms, and all that. But the second half is, are you anxious? Has this been hard for you? Do you feel, have you been able to keep up the social life that you have in the past? Do you feel lonely? And those are the ones that they really cared about. So it's the cohorts that are in our community or other studies are a wonderful way to get a sense of how life is translating and how people are feeling. The other thing, and it just, soon you learn these things and it becomes a little practical. We had sent them questionnaires. We were trying to keep everything as inexpensive as possible. And they were great at filling them out. But as they get older, they don't want to fill out a questionnaire quite so much. They want to talk to you. So you have to shift your personnel to people who will be able to get on the phone, and there are participants. They're doing us tremendous favor. We will stay on with them as long as they need, and they need to tell us about their life and the life of all their family. But that's what's needed. And the other reason I think that it's staying as high follow-up as it is, as they get older, they realize that they didn't do everything they were supposed to do when they were young. But is it too late? Are there things that they can learn, that they can change now and would make the difference? There's a quote that we all have above our desks, basically. It's by U.B. Blake, who is a jazz pianist, who said, if I knew I was going to live this long, I would have taken better care of myself. And so there's a tremendous need for this kind of information, and people want to see if there's anything that they can do that would make a difference.
Wow, thank you. And so I think what follows next from this is kind of the role of women in research. I'm skipping a question, but I'm going to come back to the advice question. As you think about your the unique work that you've done in these very different domains, what would you say about the role of women in research? And what was there anything unique that you feel about your womanhood that you brought to your research? Michelle.
I think first off, I'll say I think everyone has unique contributions to make, but I think there are certain approaches, at least that I have, and maybe some of the, tend to be somewhat more feminine, such as being more collaborative and looking for the interconnections between things, trying to understand the relationships between things, and how that shapes the larger picture. I think has been a key part of what I've done in my scientific work. Reductionism is important, yes, but we also need to understand the larger context in which pathways or whatever are working.
Thank you. Mina.
I think I would definitely echo Michelle's sentiments about collaboration. I think for me, it's, I don't know if it's necessarily about sort of sex or gender, but more, I think I've just really, the longer I'm in this business, appreciated how much value inherently there is in having diversity and representation at the table of all sorts. I think, every one of our life experiences informs so much the questions that we ask, whether it's clinical research or translational or basic. And I think the more diverse those life experiences are, the better and more innovative the questions we ask are, and how we answer those questions. And ultimately, I think that makes the biomedical research enterprise just so much stronger. And because creativity and diversity is what drives science forward.
Thank you, absolutely. And Julie, what do you think? Oh, you're muted.
The famous "you're muted."
Yeah.
That was a very interesting question, because when I thought about sort of the skill set of day-to-day research, I didn't think that I could identify sort of something that was an advantage in being a woman versus a man in this particular case. What I do think I thought about is that maybe there's a difference in the type of questions, what we're sensitized to. what we want to possibly pursue. And those are really solid scientific questions, but maybe a little bit more of, are there inherent sex differences in who gets a disease or what happens to them after that? And is anything about that going to help us know how to prevent it, how to learn how to prevent it in some way? The issues about stress or caregiving, I think might jump into my mind a little bit more readily than perhaps non-woman. Or disparities might be something that I would really think about. So I think two of us, being a woman doesn't make me be able to evaluate it better, but maybe I'm actually more interested in being able to look at it and see if we can take something from it that would take care of the fact that women might have more or less disease in a particular field.
Thank you. So we're gonna pivot to a question about the best and worst advice you've received. And you know, as I think about that for myself, I could probably write a book on the bad advice I've gotten. And I think it takes a lot of learning to know kind of what you need to listen to, because even the worst advice can have elements of that might be of benefit to you. And it's hard to know, you know, like kind of separate the kind of the hate and the pain and the hurt, and then actually like pull out that little gem. And I think for me personally, and one of the criticisms I got early on in my career is that, you know, I should just pick one thing and work on it and not kind of look across fields and see the interconnections with them. And if anybody knows me like that, my strength is to look across and not necessarily to kind of look at one thing. And so I'm really glad I didn't listen to that advice, and we'll see how it turns out in the long run. Another piece of advice that probably I didn't quite listen to is maybe I should go study philosophy, because I did better in philosophy than I did in organic chemistry. And so this was an advisor when I was applying to graduate school. So anyway, I think we all get, you know, mixed, some amazing advice, some not great advice. And I'm just curious to hear your stories, Michelle, like what was the good stuff, what's the bad stuff, and how did you manage with both of them? What were the big pieces that kind of helped you move forward or hindered you in your career?
Yeah. So I think the worst advice I ever got was from when I was in doing my MD PhD training, and I was trying to pick a lab, and a program director, I had a conversation with a program director, and he said, "I think you're making a huge mistake, and I can only hope that you will amount to something one of these days." And you know, it was simultaneously the best thing and the worst thing he could have said to me. And best because at that moment I sort of lost all fear of him, you know, and I was sort of free to do kind of what I wanted to do. I didn't end up joining that lab, not because of his comments, but for other reasons. I'll say sort of the runner up when I was in medical school, I put together an hour-long lecture on the health benefits of a predominantly whole foods plant-based diet, drawing, you know, data from the New England Journal and JAMA. And I brought this to the professor who taught our nutrition course. And he looked at me and said, "I hope you're not planning to make a career of this, because you'll never make a living doing it." So, you know, like you, Kathryn, the world is rife with bad advice. But I think, you know, the point that you made about being able to sort of listen to or be curious about, where is that coming from? And is that, you know, that person's agenda, or is there something really, a nugget of truth in there that's helpful for me? And I can remember being an undergrad and giving my first sort of big research presentation, and the PI in the lab I was working in at the time just sort of chewed me out in a practice session the day and a half before the presentation. And he was notorious for, you know, cussing and just being rude and obnoxious when he did this with his postdocs. And this was the first time that I, as a measly little undergraduate, had experienced this. And I was tremendously upset for an hour. And then I just sort of said, all right, put aside the personal stuff. What did he actually say? And what can I learn from this? And I totally transformed the talk. And it turned out great. And he was very pleased with it. And it really sort of taught me the value of being able to separate the content from the way it was delivered. I think the best piece of advice I got when I was a fellow and when I was trying to choose a project, one of my mentors, I was looking at a very sort of controversial topic for a project, but one that I was passionate about. And one of my mentors knew this, and it was really about, how can we make this work so that it is meaningful to you personally and is also going to help you from a career standpoint. And using some really innovative clinical trial design and thinking about how can we ask multiple questions in one research study. And it was great because, as it turned out, the question that I sort of kind of went in with this with, there was a negative result to, but the other question that was in there had a positive result that was very intriguing and very interesting from a scientific perspective, including to me. And that was the preliminary data for my K23 Career Development Award and sort of launched the stream of research that I'm on right now. So being able to sort of think broadly and, are there multiple questions we can ask, with this one study?
Thank you. That was great. Mina.
I think so. The best advice I got was when I was in residency. I was sort of in the second half of it, really agonizing about what field to go into for subspecialty or fellowship training. And I was down to about sort of 2 or 3 that I was really considering seriously, and like all type A people, just sort of agonizing endlessly about what I was going to do. And one of my program directors said to me, like, if you step back, these are all great choices. And the wonderful thing is, whatever you decide to do, you're never going to know what would have happened if you'd done the other thing. So don't worry about it. Just make a choice and enjoy it. And I thought that was really great advice. And so I did, I chose GI, and I've never looked back and said, what if I'd become an endocrinologist? I'm sure it would have been great as well, but this has really been a wonderful career so far. And I think in terms of advice that was maybe not so good, I'll never forget, it was, when I was a junior faculty member, just a year or so out of fellowship, my son was born. This was at Columbia University. And, we had him with a full-time caregiver for the first year. And of course, it was a very challenging time balancing all these different work demands, clinical, medicine and research, and having a young child at home. And, he was a really social kid, and more we felt like he should be in more kind of a group care setting with other kids. And we decided to, put him in this local sort of almost young nursery school or preschool. And I remember sharing this with a senior physician scientist just offhandedly when she asked me what I was doing. And she looked at me so seriously and said, "You are making a terrible mistake. I don't know why you would do this. You need to change, not make this decision, keep your nanny. This is going to end your career." And she said it was so much certainty that it really, I was so taken aback. And then for the next, couple of weeks, again, I was sort of like agonizing about, did we make the right choice? And, am I ending my career by, putting my child in effectively daycare instead of having a nanny? And it turned out to really be one of the best decisions we ever made. Forcing me to come home at a time where I could pick him up every day meant we could start making dinner together every day. And it really rebalanced my professional and family life in a way that was really positive and good for him and good for me and us. And in hindsight, I really learned that, you know, I learned I'm never going to give that kind of advice to anyone, like strong personal advice, because I don't think there are right answers. And you know, but that's definitely a vivid memory of bad advice that I got.
You know, Mina, I just want to say two things. One is that I love that story. Firstly, I think when people give us advice, oftentimes it's from their experience and their issues, and they project them on us. And I think it's always helpful to understand what their backstory is. I mean, maybe she made that decision and that was her experience, and it comes from a good place, but it's not your problem. It's not your place. But secondly, I just want to point out to you the counterfactual of, you didn't become an endocrinologist, but you became a gastroenterologist who studies hormones. And it's so interesting because I do think that by being a gastroenterologist thinking of hormones, you've opened up a really interesting avenue of, you know, what happens in the gut with hormones and motility that you may not have gotten to if you were just looking at hormones. So, you know, congratulations. Julie.
Well, I could come up with all my cutting comments that I've had over time too. They all hurt. But I've tried to do the same as Michelle and Mina have done, which is after I get over it, really think about where they were coming from and is there anything I can learn from it. So that's just a really hard lesson. But just a few things that I was told that I think really were very, very useful. My main mentor told me, you need a mentorship team. You don't just need me. So I worked with him because he was a content area, he was senior, he knew the hospital setting, and that was fine. But then I got someone else who was the methodology part of it. And then I got a sort of, not a work-life balance person, but someone I thought was sort of a role model, some that I could look at and say, I would want to be that. And so together they all had different views and were coming at it a different way. And that actually helped. The second thing is, and a faculty member just a little above me told me that at the very beginning, always be open to opportunities. So just say yes. If your mentor comes to you and says, well, someone asked me to do a review for a journal, I don't have time. Do you want to do it with me? Check with the journal. That's okay. It's like, I didn't even care about the area, but I wanted to know how to write a journal review. I wanted to know how to write an IRB application. I sort of wanted, and he would be asked to give a talk, didn't have time. So asked if I would do it. And I felt like going, I don't think I know how to do this, but just do it. And you know what? After you do it, you start being asked to do it, rather than now it coming through your mentor. You've basically just had someone have an opportunity to see you, maybe a little bit earlier than it would happen otherwise. So that was the other second thing. The third thing that someone that now is goes without saying, but at the other time, be flexible. So be able to pivot when something happens. And the prime example will always be COVID, where everybody took what they had and figured out, what can I use to answer these important questions? But you had to be able to pivot very quickly for an important or a timely question that had funding. So all the little pieces were there, and that's really important to do. And the last thing was, everybody told me, just stay calm. It's like, it's so easy to look at other people and go, well, it's so easy for them. You know, they just have a straight line career from beginning to, they must have known what they wanted in third grade. And it just isn't like that for most of us. We've got the little squiggly career, but eventually things work out, and just don't sweat it all the time.
Fantastic. Thank you so much. So we have about 14 minutes left in our session, and we're going to start to take some questions from the audience. Michelle, you can see the chat, correct?
Yes, I can.
So if you wouldn't mind doing that, I have closed, because of our reverb problem earlier, I closed my chat.
Okay. So there's a question here from John Denninger. what's your view on how allies of women in research can best work to reduce the impact of implicit and explicit bias?
That's a fantastic question. I think that, I never knew the term, coming up, mansplaining, until, my daughter pointed it out to me a couple of years ago. And I think that now you listen for it, you hear it everywhere. I think that, allies of women, I think they do themselves a great service to listen first, to understand a situation and not react to it. And I don't want to stereotype any gender here, but I do think that that is an attribute that I see more often. I personally have seen more often in women than men. And I do think it actually goes a long way to having like an emotional intelligence about what is really happening, what is underneath here, and not needing to solve and take action right away. Obviously, you do need to take action and solve, but not leading with that. So that's my kind of one, listen and give space for people to talk as a good starting point.
That's great. I was going to say there's a great New England Journal Perspectives piece earlier this past year from Michelle Mello and colleagues at MGH talking about this, and a great chart in that Perspectives piece about sort of like when you're in a situation and you hear where there's a female colleague who's actively being put down, whether that's by a patient or another colleague, just some very helpful phrases in that table for how, as a bystander, you can kind of sort of help deflect that and be supportive to the person who's being targeted in the question. And I think just knowing that there is somebody who's willing to sort of speak out on your behalf and support you in the moment is huge.
Yeah, and just to add to that a little bit more, I think that there's a lot of debate about the value of implicit bias training. I personally find it hugely fascinating that our brains are able to just kind of ignore huge problems and kind of keep going. And I think there's a great deal of benefit in understanding, and like you said, being able to be aware of when somebody is being harassed or insulted or demeaned, and being also then able to step in and help. I think if the situation again is warranted, because you have to layer your emotional intelligence on top of that. So yeah, I think that implicit bias training certainly is an important piece of this equation. It's not the whole thing. It doesn't solve everything, but I do think some awareness of how our brains think is hugely beneficial. Julie or Mina, did you want to add to that at all?
If I could add just a really quick one. You said, recognize when people are being harassed or whatever, but I'm also going to say when people are being unrecognized for their contributions. And I think we've all been in meetings or something where you can say something, nothing happens, somebody else says that thing, and it would be really nice if sometimes people would say, well, that was just said by so-and-so, or I'm just adding to it or something, but really taking the time to recognize when a contribution was made and have the courage to just call it out just a little bit.
Absolutely.
I think one thing that I think will be great for allies to actively think about and do is ensure there's a seat at the table for women. And I think that's increasingly being done in formal capacities like, panel discussions or, senior leadership committees where there's more scrutiny. But I think a lot of the informal groups and networking, I'm the only, female PI among the group of labs in my division. And so I'm sure there are just conversations and informal kind of gatherings or meetings that are happening that I just don't even know about and I'm not part of. And I think for those who are part of those meetings, to sort of our gatherings or sort of unofficial networking, that whenever it happens, to sort of step back and realize that, oh, this is actually where something is happening and somebody's not here that maybe should be, and to think about how to address that, I think would be really valuable. And I think the other key piece of really making sure that there's a seat at the table is ensuring there's a pipeline. We all talk about the leaky pipeline, and I think, you know, there are real differences and vulnerabilities in career stages between men and women, I think. And I think really finding the devil's in the details and finding ways to really, at an institutional level, address those vulnerabilities, whether it's, you know, research assistant or technician support during particularly vulnerable stages, or that, you know, things like that, that can really make a difference, I think need to be broadly considered and continually considered.
Thanks. Michelle, do we have any other questions?
Yeah, there's a question here about is there a movement or resource to connect women starting in research to women research mentors, especially for non-physician clinical researchers? Most academic medical centers have clear paths for physicians doing research, but less resources for non-MD physicians. Mentorships, is, if even informal, can have a big help resource for fellow women in the field, definitely.
What a great question, and I don't know the answer to that. Does anybody know?
At least, and it was mentioned as PhD, so I was listening to that. We do it on a division level or a department level because of the career conferences, counseling that we do every year. But that's an ad hoc. That's not a wider, you know, making sure nobody falls through the cracks. I don't know about that.
Some of the professional organizations have opportunities for mentorship for more junior people, with more connecting them with more senior people. I know MGH has an Office of Women's Careers, or they used to at least. And here at UC Davis, we have a Women in Medicine group. So I think this is starting to become a little bit more prominent, where younger female researchers can try to connect with people more senior.
Do you have another question for us, Michelle?
Yeah, this is from Susan Lord. She runs a small nonprofit where they teach integrative mindfulness and health curriculum. There are obviously many small organizations and practices doing this. Do any of you foresee a way for us to use your research instruments to evaluate our programs? And would it be valuable for large research centers to collect our research?
Great question. I would defer to our epidemiologist to Julie.
I think that's worth a discussion. I think it's an individual discussion, but absolutely. I mean, I love being opportunistic if I can, taking the work that someone else has done and seeing how we can merge it to amplify their work and our work. And a lot of these studies that would be our data that might merge with their data welcome collaborators. As long as we've got one person from our study on the collaborations, we can explain what we've done. In fact, it's emphasized to do data sharing and to leverage the money that's already been put into these studies. So I think that's the kind of thing where I would either be glad to talk to the person, or I would figure out who would be a good person to talk to it. I don't know a broader way to do it, but I think it's getting in to just talk to somebody and figuring out where to go from there.
So,
I would say one of the challenges, obviously, is that many people in the field of integrative health don't have the research training, and many people in integrative research don't have the clinical training. And so I think combining those perspectives can be really valuable and definitely help generate new knowledge and understanding.
Yeah, that's a good point.
And you can get our contact information by contacting the organizers of the conference. And I'm happy also to point people and connect people. So feel free to ask them for let them know we said fine, and we'll be in touch. As we wrap up, I wanted to just touch on this question about integrative medicine and the role of integrative medicine in the public health domain. And if there's a specific, unique role for women in this, whether as participants who receive integrative medicine, or for us as researchers who do research on integrative medicine. I know for me, yoga, stretching is kind of that hidden thing that when I remember to do it, it's so amazing, but I can't keep the practice going, and I wish I could. And similarly, supplements, I think when I remember to take my vitamin D and my vitamin B, I feel great for like a week and then I forget. So I think there's tremendous value to it personally for me, but I'm curious to know if you see any unique benefits for women with integrative medicine. Michelle, why don't you lead us off?
Many of these systems of whole person care have been around for millennia. And so obviously cultures have found value in it. I don't know if this is necessarily just relevant to women, but I think, there's two things I think that from integrative medicine that I find particularly useful as a clinician. There are therapies for sure, but I think the other is just the approach to care that is person-centered, that looks at the sort of whole picture. And it's really sort of a partnership in terms of prioritizing the patient's goals and the evidence and what makes the most sense for that individual.
Great, thanks. Mina?
So it's funny because to me, and I know part of my introduction got lost in the feedback, but I actually, after I was invited to be on this panel, I had to look up what integrative medicine meant. And similar to what Julie said early on, I realized, oh, well, actually, I do this every day as a pediatrician and a pediatric gastroenterologist, and really thinking about the intersection of diet and nutrition and microbes and health, and also I think really about mental health and psychosocial state and sort of stress response and the interaction with gut function and health. It's sort of inherent to our practice. So I think even though I've never realized that to think about it and sort of articulate it as a separate thing, I think it's so essential to good medicine.
Thank you. I love that you said that. And it's funny because, and ironic because you said, I've never thought of it as a separate thing. And yet it's the whole concept of integrating it, which I think you really conferred beautifully. Our guts, our brains, our emotions, our supplements, our food, our nutrition. And unfortunately, when we have a condition like, a gastroenterological condition or a functional pain condition, all these things are kind of weighing and interacting in ways that we have to understand and integrate to understand. So I think that, I really appreciate what you said, kind of the recognition of all that. Thanks. And Julie.
And just to add one comment onto what's already been said, the thing that I think is so wonderful is that over this last period of time, people have just become more open to integrative medicine being part of their life. They may not be sold on it yet. They may want to look at some evidence, but they're open to considering it, which means that we can do research and add things, and we can also make recommendations on many different levels. So I don't know what impact it's had yet, but I do know that I think we're sort of in a different time of people being really wanting to get some answers and make some decisions. And I think that's great.
So I want to thank you for joining me. It's been such an absolute pleasure. I've learned a lot, and I hope our viewers, our audience has learned something too. I think this is such a tough and also unfortunately interesting time in our history. And I think that we see now many women stepping up to important leadership positions, not just in medicine, but obviously in politics and research. And I think it's really wonderful that we are here together collectively to kind of work through this and walk through this and walk this walk, which I think is going to be challenging. So thanks again.